of the hour, Dr. Shu. He's here with us today, and he has a interesting presentation on CBD, cannabis, and your pet.
Awesome. Thanks a lot, Jen. I appreciate it. Let me go ahead and share the screen here. Great. Can you see that? Okay. All right. Jen, can you see the screen okay? Presentation good? Okay, awesome. All right. So as Jen said, my name is Dr. Tim Shu. I'm the founder and CEO of Vet CBD and Dr. Shu's Pet Care. And what we do is we make cannabis, CBD, hemp, cannabinoid products for animals. And the reason why we do this is because cannabis and hemp have a lot of therapeutic benefits. And so we'll go into, what the cannabis plant is, what the hemp plant is, what cannabinoids are, and some of the therapeutic benefits that we see, and what we can use cannabis for. All right, there we go. So just a quick background and introduction to the cannabis plant. The cannabis plant has hundreds of pharmacological active compounds. There's over 120 different cannabinoids. There's over 500 different other components to it. So it's a pharmacological treasure trove, and we're really just beginning to understand all the therapeutic benefits. A lot of people know about THC and CBD, but that's just a really small part of the picture. Now, it is the cannabinoids such as THC, CBD, and other things like CBC and CBG that are primarily responsible for the medicinal and psychoactive effects that we see in cannabis. Sorry, sometimes the screen gets out of order. But okay, now when we're talking about, CBD and other cannabis or hemp extracts, it's really important to understand what part of the plant this comes from. Up here on the screen, I've got a picture of a dried flower bud. This is what people usually will smoke. But when we're looking at the cannabis plants, the reason why we want to look at the flower is because when we zoom in a little bit closer, we see these little glands that cover the flower. And what these little glands are these are trichomes. And the trichomes are the glands that produce the cannabinoids and the terpenes. Now, terpenes are essentially the essential oils of the plant. So, if you ever smell a cannabis or a hemp plant, it can have a very distinctive smell to it. Sometimes it can smell like fruit, sometimes it can smell like pine, and that's because of the terpenes. And the terpenes are thought to also have medicinal benefits, especially when used in conjunction with cannabinoids. Now, the reason why I show this is it's important to understand that hemp seed oil is an ingredient to a lot of products out there. But it's important to understand that hemp seed oil is oil that gets pressed out of the hemp seeds. And the oil itself from hemp seed actually doesn't contain any cannabinoids. So that's why it's important when you're looking for products that are CBD products to actually see that they are extracted from the trichomes and not just from the hemp seed. So when we're talking about cannabinoids, everyone knows about CBD and THC, but those are just two components of cannabinoids from the plant. Now, there's three categories of cannabinoids. So they're the endocannabinoids, the phytocannabinoids, and the synthetic cannabinoids. So the first category that we'll talk about is the endocannabinoids. And what this means is cannabinoids that our own bodies produce. So our bodies produce cannabinoids, dogs, cats, horses, any animal that has a cannabinoid system called an endocannabinoid system is going to actually produce endocannabinoids. And the reason why that's important is because these cannabinoids that our bodies produce help us to maintain balance and keep us healthy. Now, the second category of cannabinoids is what's called phytocannabinoids, and these are cannabinoids that come from the cannabis or the hemp plants. Like I said before, a lot of people know about CBD and THC, but there are over 120 different cannabinoids from the plant. And we're just starting to understand some of the therapeutic benefits of not just THC, but CBD, but a lot of the other ones out there like CBC and CBG, CBDV, THCV, the list goes on and on. Now, the third category is what we call synthetic cannabinoids. These are cannabinoids that are made in a lab or by pharmaceutical companies, and these are cannabinoids that are designed to interact with our body's endocannabinoid systems. So those are the three categories of the different types of cannabinoids that are out there. Now, I mentioned earlier the endocannabinoid system. This is an absolutely fascinating system. It is one of the major components of our bodies and of animals' bodies. Other systems that we can think of are things like, the circulatory system that consists of your heart and your blood vessels, your neurological system, which consists of things like your brain, your spinal cord, or your endocrine system, which creates the hormones in your body. Well, the endocannabinoid system is a system that was discovered in the late 80s and early 90s. And what this system consists of is three components. The cannabinoid receptors that are found all throughout our body. These are the receptors that cannabinoids bind to cause their effects. It also consists of the endocannabinoids. These are the cannabinoids that our own bodies produce. And then also the enzymes that make and break down these endocannabinoids. So what does the endocannabinoid system do? For example, like the circulatory system, we know it, gets blood flowing throughout the body, regulates blood pressure, things like that. Well, the endocannabinoid system is actually a body system that its role is homeostasis. So what that means is it prevents there from being too little or too much of something. It maintains balance. And so that's why it's involved in so many different functions of our body. This is just a short list, but things like appetite, metabolism, sleep, pain, mood, memory, movement, inflammation, and even reproduction, the endocannabinoid system has regulatory functions in. It helps to maintain balance. Now, what's fascinating about this system is that it is present in all vertebrate animals. What that means is you can find it in mammals, fish, reptiles, amphibians, birds, and it's also even present in some invertebrate animals as well. So some marine creatures and sea creatures have been found to have endocannabinoid systems. Now, what this means is that if an animal has an endocannabinoid system, it has the potential to benefit from cannabinoid therapeutics. So let's talk about one of the most popular cannabinoids out there, which is CBD. CBD is great because it's non-intoxicating, meaning that it doesn't cause a high. It does have a wide safety spectrum, meaning that at low doses and high doses, it has been shown to be very safe. What's interesting is that CBD actually has multiple cellular targets all throughout the body. In fact, there's over 40 known different cellular targets, and it interacts with these cellular targets to be able to produce the therapeutic effects that it has. So some of the benefits of CBD that we know of include things like pain relief, anxiety relief, seizure control, nausea relief. It's a neuroprotective. It also has anti-inflammatory properties, and there is potential for cancer. The reason why I have a question mark next to cancer is because we don't have enough studies to say one way or the other. We have some preclinical studies out there, meaning that we're looking at lab animals like mice or rats, and then also looking at how these cells behave in environments like petri dishes or test tube when applied with CBD. And those studies have shown potential benefit when it comes to cancer, but we don't have any of the large-scale clinical studies that we need to be able to say one way or the other that CBD has a noticeable and appreciable effect on cancer cells. And cancer can be very, very different. For example, lymphoma cells are going to behave very, very differently than cells from, like, say, prostate cancer or any other kind of cancer in the body. That's why chemotherapeutic options are so different, because the cells respond differently. Does that apply to CBD and cancer? It may be the case that we may need different formulations or different ratios to be able to utilize cannabis for different types of cancers. We'll get into that a little bit more later on. So THC. THC is another really well-known cannabinoid. And what's really important to understand is that THC does have medical benefits. Now, the intoxicating effects of it, or feeling high from CBD, occurs through the CB1 receptors that are found in the brain. When you have a large amount of THC that interacts with those CB1 receptors, that's when you start to get the intoxicating effects. That's when you start to feel the high effects. Now, these intoxicating effects are going to be the limiting factors for therapeutic uses. Some species of animals, like dogs, are going to be more sensitive to THC because they do have more CB1 receptors than other species in certain parts of their brain. But that's not to say that THC can't be used medicinally in animals. It absolutely does have medical benefits, but it needs to be used very, very carefully. So dosage and formulation are going to be key. Like CBD, THC has multiple cellular targets to act on in order to elicit its therapeutic benefits. Now, what are some of the medical properties of THC? Everyone knows about THC because of what people use it for when people use it recreationally, but it's really important to understand that THC also has a number of well-documented medicinal benefits. And some of these include pain relief, appetite stimulation, nausea control. It's an anti-inflammatory and also has neuroprotective properties. And like CBD, there is potential to use it for cancer as well. There's a lot of preclinical studies out there in lab animals and petri dishes and test tubes looking at using THC to fight cancer cells. And there is some promise there, but like CBD, there's not enough large-scale clinical studies to be able to look at that and say, okay, definitively, we see benefits of THC for this type of cancer, that type of cancer for this type of patient. So what are some of the clinical applications that we use cannabis for? And a lot of people, refer to things as just CBD. But what I like to refer to this field of medicine is cannabinoid therapeutics, because really we don't just look at CBD. We look at a lot of the other cannabinoids that we're able to get from the cannabis plant, including things like THC, CBC, and CBG. So you'll hear me refer to things as cannabinoid therapeutics. So some of the clinical applications that we use for cannabis include pain control. What that means is, both acute and chronic pain, which means pain that just suddenly happened, or chronic pain that has been going on for a while, things like arthritis. It can also be used for neuropathic pain, so pain that's originating from damage to the nerves, such as when we find with a disease called IBDD, which we commonly see in dachshunds or corgis that have back injuries or that have essentially a disc that slips and presses against their spinal cord. We do see a lot of benefits for those patients when it comes to neuropathic pain. Anxiety and stress relief is another really big one. So we have a lot of clients that will use it for separation and noise anxiety specifically. Noise anxiety is a really, really big one, especially around July 4th. July 5th is actually the busiest time of the year for the shelters because there's so many pets trying to run away from the noise of the fireworks. And we do have a lot of clients that use cannabis specifically for anxiety reasons. And what's fascinating about cannabis is that it takes away the anxiety. And when dosed and formulated appropriately, it's able to do that without sedating the patient. That's something to keep in mind, is that sedation does not equate to anxiety relief. Sedation simply means that you can't do anything physically about the anxiety. So you can still be sedated, but be anxious. And so what we're looking for in patients that have anxiety disorders is specifically to relieve that anxiety without sedating them. And we do have a lot of clients that use it very well for patients that have separation or noise anxiety. So another big use of cannabis is for inflammation. And we see a lot of benefits in our patients that have skin allergies. The anti-inflammatory properties of CBD and THC and other cannabinoids help to decrease the excessive immune response that we get in conditions like allergies. Now, it also has the potential to be used in other conditions that have excessive inflammatory responses like IBD, IBS, chronic GI conditions that have excessive inflammation, and potentially also autoimmune disorders. But we do need more research for the autoimmune disorders. But that is another big use for cannabis, is whenever we have clients and animals that have excessive inflammation, the cannabinoids can help taper down that excessive inflammation. Nausea is another big one. A lot of people have heard about, patients, human patients using cannabis specifically for nausea, whether it's because they're undergoing chemo or they have other conditions. And in animals, we use it for nausea as well. We have a lot of people out there that have older cats that have kidney failure. And when cats have kidney failure, they tend to get very nauseous and they lose their appetite. So we do have a lot of people that successfully use cannabinoid therapeutics to help to control that nausea and then also to help stimulate the appetite. other conditions that cause nausea, for example, cancer, chronic GI conditions, or even motion sickness. We actually have a lot of people that will use it specifically for car rides. They'll give it 30 to 60 minutes before a car ride to help suppress that nausea that some pets may get when they're going for a ride. Now, it's important when we're talking about appetite stimulation to realize that CBD actually isn't a very good appetite stimulant. It's very helpful for controlling nausea, but in patients or in animals that we specifically want to stimulate appetite, that's where THC comes into play. Now, again, I want to remind everyone that when it comes to THC, got to be very, very careful, and it needs to be done by someone that's very, very experienced in that and under the supervision of your veterinarian, because THC can be used medicinally, but in the right dose and the right formulation. And some of the reasons why we use THC to stimulate appetite in these patients are for kidney failure patients that aren't eating, cancer patients that have lost their appetite, or for severe GI conditions in which we need to stimulate the appetite. Neuroprotection is something that's really, really fascinating about cannabinoids. There are a number of clients that we've talked to that have seen improvement in their animals, specifically dogs primarily, that have seen benefits for cognitive dysfunction. So cognitive dysfunction can happen in older animals, just like how it can happen with older people. Sometimes they may get confused, they may bark excessively at night, they may have trouble sleeping, and we have talked to a lot of pet owners that have successfully used cannabis to help restore some of that cognitive function that their older pets have seem to have gone downhill over the years as they get older. So that's something that's really, really neat. But we do need a lot more studies in this area because some of these things are harder to directly measure versus something like pain or anxiety. There's a lot of ongoing studies looking at cannabinoids for neurodegeneration to prevent things from worsening, for example, in people like with Alzheimer's or Parkinson's. There is also some interesting studies out there that have looked at animal models, in particular pigs and rats, and looking at using cannabinoids for CNS or brain injury. A lot of the two of the studies I'm thinking of right now, they looked at stroke in pigs and rats, and they found that the animals that were on CBD before or received CBD afterwards actually had better recovery rates and had a smaller stroke infarct area. The other thing that we really find a lot of benefit for with cannabinoid therapeutics is for seizures. A lot of people have heard about using CBD or cannabis to help control seizures in patients that have epilepsy. Animals can get seizures, animals can get epilepsy as well. Primarily we see it in dogs, but it can happen in other animals too. Cats, horses. I've even heard of seizures and epilepsy happening in sea lions. But primarily most of the patients that veterinarians see that have seizures are going to be dogs. And what's amazing about cannabinoid therapeutics is that it has the ability to decrease the number of seizures a patient's having, but also if they do have breakthrough seizures, we've seen a number of cases where the breakthrough seizures were far less intense than what they were before. And we actually have a number of clients that have told us that they had actually tried multiple different seizure drugs that were unable to control their pet seizures. And it wasn't until they tried cannabis that their pet seizures were actually able to be controlled. And so this is a story that you hear sometimes with humans as well, is that they go through multiple anti-seizure drugs, but it isn't until they try cannabis that they actually control their seizures. Now, this isn't to say that other medications shouldn't be considered or shouldn't be used. It's not all or nothing. What we look at cannabinoid therapeutics as is an additional tool in the toolbox of the doctor, and so we want to be able to continue to be able to look at all potential therapeutic options and recognize that in some cases, traditional medications may be better. And in other cases, cannabis may be better. And in other cases, a combination of the two may work best for the patient. Okay, so I was talking about cancer earlier. A lot of people have questions about cancer. They hear a lot about how cancer can be beneficial and how it's it's helped this person or helped their animal. Like I was saying, there's a lot of preclinical studies that have shown anti-tumor benefits of cannabinoids like CBD and THC, including things that show that they inhibit tumor cell growth, cause the tumor cells to die off, prevent there from being new blood flow to the tumor cells, and also prevent the cancer cells from spreading. Now, while this is promising, that doesn't necessarily translate to our patients, whether they're dogs, cats, or humans. And the reason why is because sometimes in these lab preclinical studies, you may get results that don't actually translate to the real world. So whether or not we'll find a lot of benefit for cannabinoids with cancer remains to be seen. But it is something that is very exciting because potentially cancer patients have an additional therapeutic option. And we have seen some very interesting cases ourselves. Animals that were diagnosed with cancer and that were only expected to live for weeks, but the owner started cannabinoid therapeutics and extended the lifespan out into months and sometimes up to a year after that initial diagnosis. So some of the veterinary clinical trials that have been done out there, now keep in mind they're very, very limited because it has been very difficult traditionally for especially universities to study anything related to cannabinoids. But recently laws have changed and a lot more universities are starting to study cannabinoid therapeutics. And so, over the next 3 to 5 years, we should start seeing a lot more papers come out that really dig in deep and help us to understand the best uses for cannabinoids. So this was actually a study that was done over at Cornell that looked at using CBD for dogs that have arthritis. And what they found was that the dogs that were receiving CBD actually had decreased pain and they actually had increased activity levels. Another study that was out of Colorado State University that was released about a year or two ago looked at using CBD in seizure groups, in seizure dogs. And what they did find was that there was a reduction of seizures in the dogs that were receiving CBD. But this study does need further development because some of the results weren't as clear that says that, yes, CBD was benefiting these, this treatment group and the group that got the placebo, they actually saw a seizure reduction in the placebo group too. So what that means is that we need further studies when it comes to seizure control in animals, especially with dogs. Now, something that's really important to talk about is when people are looking for CBD products or cannabinoid therapeutics in general, is to recognize what's called full spectrum and what's called isolate. So full spectrum, an example of that is on the left, and then an example of an isolate product is on the right. The reason why this is important is because they differ in their therapeutic properties. So if you look at the left-hand side, you'll see that this is a full spectrum extract. It contains multiple cannabinoids, including the CBD. So it contains small amounts of THC, CBDV, CBG, even some THCV and also CBC. Now, this is a full spectrum extract, meaning that it has multiple cannabinoids in it. And on the right-hand side, you'll see that this extract is 99+% CBD. So it's pretty much just all CBD. And this is what's referred to as an isolate or a single molecule form that doesn't contain other cannabinoids. So why is this important? Why is this important? Sounded like a cartoon there. So the reason why is because full spectrum products provide what's called the entourage effect. This is a synergistic nature of multiple cannabinoids working together. So essentially what it means is 1 + 1 = 3. That rather than get the therapeutic results that we might get from just an isolate, we combine the cannabinoids and we actually get greater therapeutic benefits. And this has been shown a number of times in multiple studies looking at different therapeutic avenues. And so the first one was one that was looking at a CBD isolate versus a full spectrum extract and looking at its use in pain and inflammation in lab animals. And what they found was that what's really interesting is that when they use a CBD isolate, the responses were a bell-shaped dose response curve, meaning at low doses, it offers some benefit. At a mid-range dose, it offered the maximum benefit. and then at a high dose, it actually offered a diminished benefit. So what happened with the CBD isolate was they had to find that sweet spot, because too low a dose, you weren't getting the benefits that you want, and then too high a dose, you were actually getting less benefits than what was a mid-range dose. Now, the full spectrum, a whole plant extract, as some people like to call it, what that did was it responded in a correlative dose response curve, meaning that at higher doses, it actually hit a ceiling, or it continued to have therapeutic properties, or it continued to have increased therapeutic properties, but it didn't actually diminish. So that's something that's really, really interesting about that study, looking at CBD isolate versus a full spectrum extract and the benefits that you get from a full spectrum extract. There was another study that looked at the anti-tumor action of pure THC versus something that had a full spectrum. And what they found was that the full spectrum extract actually had greater anti-tumor effects compared to pure THC. And they tested this in both cell cultures and animal models. When I say animal models, these are lab animals, so like mice and rats, not so much dogs and cats. And so that was an interesting study that saw the benefits of a full spectrum product having more anti-cancer benefits compared to pure THC. Let's see how I'm doing on time here. 7:37, not bad. Okay, so this is an interesting study that looked at a lot of the studies that have been done in humans that have epilepsy. And what they showed was that a full spectrum extract that had primarily CBD, but had multiple other cannabinoids, actually had greater reduction of seizure frequency. They were able to use lower doses, and they had fewer side effects compared to something that was made with CBD isolate. So that's actually a really interesting study, because what that shows is that with full spectrum extracts, you are able to have greater therapeutic effect, use lower doses, and have fewer side effects compared to CBD isolate. Okay, and this other study looked at a full spectrum CBD extract, and it looked at rats and neuropathic pain. And what they found was that this full spectrum extract actually provided better anti-pain properties than either CBD or THC isolate. So again, another study looking at using full spectrum and finding that it provided better pain relief compared to either CBD or THC isolate. And so that's why it's so important to, when you're looking at a product, to find out if it's made from an isolate or if it's made from something that's full spectrum, or there's something in the middle called broad spectrum, which is the THC removed, but it still has some other cannabinoids like CBC and CBG. And how do you find out? Well, you ask the company. And based off of what they say, they should be able to provide a certificate of analysis, or a COA. And what that is for every batch that they produce, they should send it off to a lab so that the lab tests it for the different cannabinoids in there. It provides a report so that you, as the client, the customer, is able to see what that is, to make sure first that you are actually paying for what you're getting. Because a lot of times what studies have shown was that a lot of the CBD products out there may not actually contain what's on the label. So if the label says 200 milligrams, it may or may not have 200 milligrams. And so that's why a COA is important, to be able to back up the claims that are made on the label. But also looking at the different cannabinoid profile that comes from a COA, that will help you determine if it's a full spectrum, broad spectrum, or an isolate product that they're making. So in terms of the dosing, what we find is that the peak plasma concentration, meaning when it's most optimally effective, after giving it orally with through the mouth or into food in dogs, tends to be about 1 to 2 hours. Now, it's important that the dosing is very variable, is variable based on the condition that we're using it for, and also the individual. So for example, we have some large dogs that are 70 pounds and that are using it for seizures. And sometimes they can use a very small amount once a day. And in other cases, they may need to use it 2 or 3 times a day at a higher dose. So it depends on the patient and it depends on their condition. But what we always recommend doing is to find the right dose for that patient, is to start at a lower level and then gradually titrate it up to optimal effect. That way, you're not leaving any potential therapeutic benefits on the table, and you're also not using more than what you need. As I was mentioning before, cannabinoid profile is something that's really important when we're discussing products that will provide the optimal therapeutic benefits. Like I said, full spectrum is going to provide the optimal therapeutic benefits compared to something that's made of a CBD isolate. So we want to look at something like the presence of the cannabinoids, including things like THC, CBD, CBC, CBG, and sometimes you may have other minor cannabinoids like CBDV or THCV. Now, it's really important, like I said before, that if THC is in the picture, that it be dosed and formulated appropriately. And regardless of whatever formulation that you're using, you always want to make sure that you're discussing this with your veterinarian, because your veterinarian is your primary caregiver. And any sort of medication, any sort of supplement or anything like that, you want to make sure that your vet is kept in the loop. Cannabinoid ratio is something that's really important. For example, on our cannabis side of things, we have a 20:1 CBD to THC ratio product that we've been producing since 2015. And then we also launched a 10:1 CBD to THC ratio at the beginning of this year. And that slightly increased amount of THC is for patients that can benefit from it, including patients that have things like severe pain, end-of-life care, patients that have severe symptoms and side effects from cancer. And then sometimes we also find that patients actually do better with the appropriate amount of THC for a lot of these more serious conditions. But again, always under the supervision of your veterinarian. So start low and titrate up to the effect is what we always recommend. Like I said before, that way it helps you to find the optimal therapeutic dose. That way you're not using way more than what you need, but also so that you're not leaving any benefits on the table. So start low and gradually titrate up to optimal effect. As I mentioned before, lab testing is something that's really important. And so when we're lab testing, what we do is we do a triple lab testing procedure. So what that means is we will test our source extract material for cannabinoid potency. We'll test it for pesticides, residual solvents, microbials, mycotoxins, and heavy metals, so that we know that we're using clean quality material. And then what we'll do is during the manufacturing process, we'll have it tested again for potency, because we want to make sure that whatever we put on the label, if it's 125 milligrams of CBD, is actually 125 milligrams of CBD. And then prior to going to the retailers, we will batch test every single batch that's produced again for all the things that are listed here: potency, pesticides, solvents, microbials, mycotoxins, and heavy metals. So we want to make sure that from start to finish, we're dealing with clean, safe, consistent product. So some of the caveats that I always like to tell people about is that cannabis has a lot of therapeutic potentials, and it has a lot of therapeutic properties, but it is not a panacea, meaning that it is not a cure-all. So it's not going to fix everything out there. It's very good at helping out with some conditions, but it's not a cure, and it's not going to benefit every single condition out there. And even for a lot of the conditions that it has well-known therapeutic benefits for example, seizures, it's not going to work 100% of the time in 100% of the patients. So that's something to keep in mind, is that different medications, different therapies will work differently for different patients. Now, you do want to use caution in cardiovascular compromised patients. So that what that means is patients that have any sort of heart issues, you do want to use it cautiously. Cannabinoids can alter the heart rate of patients, and also sometimes the blood pressure. So that's why that's why if you have an animal that has heart issues, you certainly want to consult with your veterinarian first before doing anything different. Drug interactions. This is a common question. Can CBD potentially interact with other medications? Now, CBD is what's called a competitive inhibitor of certain liver enzymes. And so what that means is that if a patient is taking CBD in conjunction with other medications, there is a theoretical possibility that that other medication may not be metabolized as efficiently. And so that's why it's just really, really important, especially if you or your pet is on any other medications, that you consult with your veterinarian first, because some medications have very narrow windows of safety. So what that means is, you have to use enough for it to be therapeutic, but too much of it can be dangerous. And so, that's why with those medications, you want to be careful and talk to your veterinarian first before including anything new. That's not just cannabinoid therapeutics, it's anything new. Your veterinarian is the primary caretaker, and you want to make sure that you run any change in protocol through your veterinarian. So for those of you that are in California, AB 2215 is a law that went into effect January 1st of last year. This law actually protects California veterinarians and allows them to discuss cannabis with their clients. Now, it doesn't allow for prescription, but they are allowed to discuss cannabis with you if you are in California. So a little bit about us and what we do. We are veterinary formulated. My name is Dr. Tim Hsu. I'm the founder of Vet CBD. We do have veterinary nurse support as well. So for our clients that have questions, they can always email us or call us, and we have veterinary support staff that are able to answer their questions. We do use full spectrum cannabis, so that way we're able to get all the therapeutic benefits that one finds from a full spectrum cannabis product compared to an isolate. We do test rigorously throughout the supply chain. Like I said, our products are triple tested, and our cannabis line is available in California cannabis dispensaries. We are going to be rebranding our hemp line to be Vet CBD Hemp, and that one is going to be available through our website and outside of the dispensary retailers. The things that we use it for, we use it to support joint mobility, to help support normal brain function, to help maintain normal GI health, and to help pets keep calm and free of stress. So that is my presentation, and looks like 2 minutes early. So normally I would ask if anyone has any questions, but I don't think we have a Q&A set up. So that's it. If you guys want to reach out to us, we'd love to hear from you. Our website is vetcbd.com. You can also visit drshewspetcare.com for our hemp line. You can follow us on Instagram, Facebook, and Twitter. If you have any questions, reach out to us. Always happy to help out however we can.
Hey, thank you. There was so much information in that. I cannot wait to rewatch it again and with a notepad and paper and take some notes, because there was just so much to learn. Thank you so much. We'll be in touch soon.